Hey YouTube, it's Amanda. I'm coming back with a quick post-op update. I am through surgery. I have survived, so that's complication number one out of the way. I did not experience death, as you can see. It's about 5 o'clock. I had my surgery about 5 hours ago. They were a little bit late, so about 4.5 hours ago. And have been in my room on the floor now for about an hour. Was in recovery for probably about an hour before that. So I think my surgery took probably an hour to hour and a half. I was not given times, but not an extremely long time. So I'm now on the floor. I think my procedure went really well. I have not personally spoken to the surgeon yet. He went straight from my case into another case, or a couple of cases, so I'm not sure if he'll come by and visit me tonight or in the morning. But I'm good now. And pain level, one thing my surgeon did that will hopefully be a help in the long term is that he did a I think they're called tap blocks. The anesthesiologist did this, I guess. Tap blocks where they inject kind of pain blocks in 5 different locations across your stomach, and it's supposed to help kind of block that whole abdominal area from pain. And so because they did that, I thought they were also going to do a PCA pump, but they did not order a PCA pump for me with the they were going to switch it to Dilaudid because I have a morphine intolerance. But I did not get that. So I was having some pain in the OR, in the recovery room. OR was great. I had no pain, obviously, there. I remember, I don't even think I counted down. It was just there 1 second and in recovery the next. So that part was really good. And in recovery, I was having some pain just from that primary and the biggest incision site, because the tap block evidently can take a little bit of time to kick in, and because I was not also on a PCI pump, I did not have, there was just a kind of a moment of time where I was having some pain, but took pain meds through my IV, and that has been ordered to continue, I guess, through tomorrow, which is the rest of my stay here. Or I have the option of go ahead and moving to the liquid pain meds, which I may try to do while I'm here in the hospital to see how I tolerate. Otherwise, the pain med, the IV, got the pain under control, and I'm having just a little tenderness at the incision, that biggest incision site. I'm not having severe gas pain, a little tenderness in my shoulder from gas, a little tenderness in my belly from gas. And I will get up and walk here very shortly. The nurse, they're checking on a lot of patients right now, and so they're a little bit busy to come kind of help me with that. So within the next hour, I should be up and walking. So I've been here long enough to get my first meal. This is my first post-surgical meal. Let me show you this. See if I can show you. Sorry. So iced tea, hot tea, some Jellos, chicken broth, vegetable broth, a popsicle, waters, and then I've been eating these ice chips here. So clear liquids for today, and then I think probably by tomorrow I'll be on full liquids, and then for my surgical practice it's full liquids for the first 3 weeks post-surgery, and then you move on to soft foods and pureed for the next 9 weeks, and then to regular food after I guess a total of 12 weeks, which just seems pretty strict compared to some other people's diets, but that's okay. I have had no problem with the ice chips. I did feel a little bit of queasiness at one point because I had taken it in too fast, and it was kind of as they were trying to get that pain stuff worked out, so it could have been, I kind of respond to pain with nausea, so it could have been that. I'm not 100% sure. I've had a couple of tiny bites of this broth, more like sips of this broth with a spoon, and I have had no pain. Definitely an awareness of like, oh, that's that tiny tummy. But I did have a little bite of the popsicle and did feel like that might not be a good one for me because of the sweetness. It didn't seem to go down very well or sit well once it got down there. It went down fine. Didn't seem to sit well when it got down there. So we'll see. I might give it another. I might give another 1 or 2 more bites. So that's it. My nurse did bring me some chapstick. Don't forget your chapstick, especially if you were in this scopamine patch, because evidently that's what's drying. The anesthesia plus that is what's drying up all of my lips and my skin and my mucous membranes and whatever. Oh, and the oxygen. I do not think this is typical, but I personally have kind of some neurological stuff that when I am under anesthesia, even if it's spinal anesthesia, my blood pressure, my heart rate tends to go really low to like the 40s, and so they kind of keep me on extended oxygen to help with that. So I do not think this is normal for every person, and I don't think I'll be on it for very much longer because I am, my oxygenation level is 100% again, and my heart rate is back up into the low 70s. So that's it. I am officially a sleeved patient. I've been sleeved, and I feel good. I feel like I could, I don't feel bad. I don't feel just a little tenderness, not pain. We'll see how that continues when, because I'm on these IV pain meds. I think I will reach points where, it could reach a point where I could see how is this really going to feel, rather than just having a button to push, because it's not based on, I have to call out for pain meds, so I don't just get to push a little button. But that is it. Thanks so much for watching. Best of luck to my surgery buddies going in, and for me, so far so good. So I'll keep updating. Today is December 3rd, 2013, and it's a big day. So thanks for watching. Bye-bye.